an assessment form could be a very useful tool to come to a diagnosis and to set a treatment strategy. But before you use the assessment form, I would like to share with you two important details. First of all, when you do history with a patient, listen to your patient. The first question you ask to your patient is, tell me, what can I do for you? How can I help you? And then the patient is going to talk. Let him talk and listen. And he's going to tell you some interesting information. And if you then want to incorporate this interesting information in the appropriate section of an assessment form, then this is going to be stress. This is going to be unpractical. So just sit back, relax, and listen. And remember some important details. Yeah? Let the patient tell his story to you in his own words. After a few minutes, automatically he's going to stop, and then you take over, and then you follow the specific sequence of the assessment form, and then you're not going to forget anything, and you're going to have a structured history, structured inspection, examination, and so on. The detailed analysis of each section of the assessment form, that's going to be subject of some other films. And the second remark I would like to make is once you reach the diagnosis, you're going to set a treatment strategy. Write down your treatment strategy. Yeah? And of course, you're going to do some treatment procedure. Write down exactly what you're doing. When you are, for instance, manipulating the patient, describe which manipulation do you use. I use the stretch manipulation. I put the patient on his left side, for instance, painful side up, hypothetically. This was the result. And then I continued with this technique, and this was the result. Actually, you should document your findings in such a way that any other colleague who also has a good basis of orthopedic medicine, when he looks at your file, that immediately it is clear what the problem is, what you do about it, and what the evolution is. Documentation is super important. So take into account those important elements. So I refer to other films for the detailed analysis of the assessment form.